Abbreviations for doctors are on page 88, down there at the bottom. So, just so you kind of have an idea of those, I would assume that you would know most of that, but probably not the podiatrist. Well, yeah, I even see the podiatrist would be PDM. Your podiatrists are your foot specialists, you know, and so they've actually are much more, have much more training than they used to have. And so it's like an eye doctor that's an MD. They go to a special school, you know, and then a doctor of podiatry medicine goes to a podiatry school. I don't even know where they are, but they can do medication and things like that, but they have to pretty well limit themselves to feet, correct? Yeah. And then healthcare occupations are on page 90, and I'm sure there's been a lot of those added. Probably the thing that we're dealing with as much as anything that's fairly new is the physician assistant versus the nurse practitioner. We probably have 10 to 15 new nurse practitioners in this area in the last 5 years in POTO. And it's been wonderful for some of these doctors that are so horribly overworked. A physician's assistant used to be a 2-year program. Now you can get a doctorate in it, I think. Basically, there are physician assistants. It is a very different, a nurse practitioner basically they have to work underneath a doctor, but they can have their practice separate. You can have a nurse practitioner who practices in a clinic all by themselves. And they have a doctor that works over them, and so they actually work for the doctor, but you're seeing a lot of these clinics spring up. There's 2 or 3 of them in Heavener now. There's probably 3, 4 of them here.
Health and Wellness in Stigler. Last few times I've been there with Jacqueline, it's been a...
Nurse practitioner.
Yeah.
Yeah, they're set up to do that, and it's to
But
try
she
to...
couldn't write us out a prescription.
Yes, oh yeah, she can. Yeah.
Well, there was something she couldn't do that we had to go, oh, no, it was some paperwork that we had for Jacqueline that needed to be finished. She couldn't do it, the doctor had to do it.
Probably for disability, I think a doctor has to do it, a nurse practitioner can't do it. Or maybe even possibly, no, they're ordering equipment. So they have they can do a lot of that stuff. A physician's assistant cannot operate individually from a physician's clinic. They have to work directly with the physician. And so if some of you who did River Valley, there's 2 physician's assistants there in that Mercy River Valley orthopedic area, and so I don't even think they have nurse practitioners there, but anyway, you see a lot of nurse practitioners. What it's done for some of these doctors here in town is it's made them so much more efficient, like Dr. Carter. Oh my goodness, Dr. Carter is one of the best people I know. Like I think I've told you this before, but if you have someone who has congestive heart failure or has COPD, he's one of the best people I've ever seen to keep all of the blood work normal, and he just has a knack for it. He can keep these people alive for 10 years. I've seen him do it. I mean, it just blows me away. But he has to have the time to spend with those people. And so what a nurse practitioner has done for him is that they go and take care of people who just come in and need an antibiotic. You know, and so that gives him time to spend more time with the specialty that he is. And so that's really helped these doctors in this town to have a nurse practitioner to work with them. Any questions on any of them? There's a lot more of them coming out. Okay. Do y'all have any questions on the Medicare? Has anyone spent any time even thinking about that? Probably not. Huh. Well, it's not going to be on your test. What we'll have on the test is all out of chapters 1, 2, and 3 on those questions. Almost every one of those questions come from that, okay? So it'll be chapters 1, 2, and 3, and just study those questions and you should be fine. I don't spend a lot of time. You should make an A in this class if you do the work. You see what I'm saying?
Like the matching questions on there also, or
Yes.
just the
To
questions?
match all of the homework. Study your homework and you should be fine. Okay?
It'll be Wednesday?
It's Wednesday during this time. Okay.
When are we, in rehab, when are we gonna have a test for the spinal cord thing? You said to study that?
What day? If you look on your paper, there's a day to do the spinal cord stuff. I'm not even sure today.
Who's paying it?
She's still.
I told Amy, I said, that's the text she's handing out now, she cited for a state today. Hey, can I get a copy of the tilt table? I've lost mine. I'll have to do it
You'll
again.
come to my office, I'll get you one. Okay, I'm giving you these, but what we're gonna do first is take a little pre-test, a little self-assessment on how you're, maybe I'll just look at it. I want you to, we're gonna look at these, so take this little test first. I'm heading on now. This is to make you look at your job and what kind of an asset you are to your people that you're going to work with. Patient satisfaction type thing. So take this first. So how did Thursday go? Did y'all learn a lot about touching bodies? And how effective you can be and how much power you have to do it? Did it make y'all think a little bit of what we were doing with Bonita?
Yeah, oh my gosh.
Yeah.
Yes, we kept thinking of her over
Yeah.
and really.
I'm so excited about her. She is such a perfect patient for y'all to learn all this NDT stuff on. Okay, so you're gonna think about patients and your clinical experience and how wonderful you were, but you also wanna put in there, once you get hired, how are you gonna be?
Is that supposed to say almost always?
Almost always, yeah.
Almost. Not quite.
that done? This is kind of yes or no. I mean, are you good at this or you not? So how many of y'all got 15 or more?
What, almost always?
Uh-huh, that would be almost always. Sorry, that's not on there, I don't know why it's not. How many of you got more than 10 or more? How many of you got less than 10? Anybody? I would think that's true about y'all, but I think some of these that are important, of course, the confidentiality and stuff has become an issue that's legal issue, right? So we certainly want to maintain those things. When people complain, I listen, I don't snap back or make excuses. That one's a toughie. Let's see. I'll tell you where you have to kind of work on some folks, and I don't see any of y'all being real loud, but some people are just loud naturally, and so you have to kind of think when you're in the hallway, walking, you know.
Check that against me, 'cause I'm loud.
Well, you just have to be aware that when you don't want to be so loud that you disturb people, because some people are just loud and boisterous, and so you don't want to speak loudly. You have to kind of get down with, take your voice level down and that kind of stuff. Do y'all help people when they look confused, or do you think that's not your business? Especially if you're, in a hospital and someone is lost and you're working there, because they expect you to help them, or they might even ask you. I think all of you are pretty good about making eye contact, but remember how important that is, and I think Kendall spent some time with you on shaking hands. If you are not a good shaker of the hand, I would recommend you improve that, really work on it. Because I find that overall, especially men, do not shake hands well here. And I've often thought, well, maybe they're afraid they're gonna hurt my hand. But it's the weirdest thing to me for someone to just kind of barely, and I don't know, and I'm assuming it's a cultural thing in this area because I never noticed it before, but that's really important for a man to a man especially, I think. That whatever that man thing is that y'all have, I don't know about, the man thing's just weird to me. But it's important for you to shake each other's hands pretty hard, almost hurt them. That's what I understand.
That's a first impression.
So you're saying men around here are just naturally weak?
Well, I don't know what it is. I think they've been taught by their mother how to shake a hand. And I spent time with my son because I saw it as a problem. That you better learn how to shake hands. And look people in the eye, because I have a kid that has been shy over the years, although he's not anymore. But, I really thought that was important, and I don't know where we've lost it. Used to, kids just pick things up, but I think parents don't spend enough time with them anymore for them to do that. So you have to make an effort to do those things with kids now. And it's kind of scary because we miss things that normally they would have picked up because you spent, you had your mama with you 50 hours a week or whatever.
Do you find that men at church do that to you as well?
That they don't shake my hand. I think they're afraid they're gonna hurt me. That's, yeah, it's probably true. Let's see. There's one other I wanted to look at. This is mainly just to make you more aware. I was at a hotel this weekend in Houston, and the Embassy Suites, and there was not one time that I could tell you that those people didn't absolutely bend over backwards. Hotels teach their people customer service, all the way down to the little lady who did not speak a word of English that cleaned my room, not a word. And it's just, they smiled when you walked in. They were trained. They were well trained. There was not, I interacted with a lot of people and I was amazed. It was just really good because that doesn't always happen. And remember that in hospitals now, that is becoming more and more of an issue because satisfaction of the patient is what is grading these hospitals. That's a big grading part of what's going on with hospitals. So if you go to work for a hospital, then you need to realize that. You cannot be short with patients. And when someone is short with patients and you're working there, then they need to get in trouble. You see what I'm saying? And what do you think people remember? They remember that one time. They don't remember the whole week of people being nice and bending over backwards and taking care of them. They remember that one time when that x-ray tech treated them like they were, a piece of dirt. And sometimes they do that. Oh, I know one of them was being gentle with people when you move them around. Not hurrying and rushing, but being gentle. That's important when someone is sick. Anything else you want to point out on this? I just thought it was a good little thing to look at.
Well, you always gotta realize these people are uncomfortable, don't feel good. It's not like they wanna be there.
Right.
So you gotta try to make it as good an experience as you can possibly make.
Yeah, you do have to do that.
And they all deserve respect, especially in nursing homes. I feel.
Yes, they do. Something, before we go into the resume writing, your resume is the same number of points in this class as a test, so it's important that you do your resume correctly. And so we're gonna spend quite a bit of time on it. And then I have a speaker coming in to talk to you about resumes, and they're very different than they used to be. My resume, when I graduated from, when I applied for a job here at Carl Albert 19 years ago, my resume was 4 pages long. They don't want resumes 4 pages long. They want 1 page. So it's very different. I did give you some interview do's and don'ts, and I think Jay will talk to you about that a little bit. You might read over those. Probably about an interview that stands out on this is make sure that you realize that you have a lot of privacy issues that you don't have to share with everybody. If you don't have to share probably women this more affects you, how many children you have. There's just a lot of things that they can legally not ask you anymore. They get around that in different ways, but they can't come right out and say, how many children do you have? They can't,
What would some places not wanna hire you if you have very many, thinking that
well,
you're
if
gonna
you're a
have to
new,
leave work or
I
something
think
like
that if Chris walked in the door with you, and let's say, Chris might actually get the job because they're worried that you're gonna be out with your kids too much. You see what I'm saying? So it is a possibility that you won't get a job over someone else because you're of childbearing age. And you can't prove that with people. I'm just saying that, so you don't wanna talk about your kids. I would tell you not to, whatever you wanna share is fine. You can talk about whatever you want, but you don't not wanna get a job because of something that you talked about.
Wouldn't you just wanna answer questions that are asked and not?
Yes, you don't want to
Short and
expound
sweet.
on everything.
Yeah, short
Yeah.
and sweet, don't
Yeah.
add anything you don't have.
Here are some questions that are most asked during an interview and there may be some that they can't ask. Tell me about yourself. What type of position are you looking for? You always want to prepare yourself that you've looked online now because everything's online, and quite frankly, you're gonna send your resume in and you might get an interview, right? So now resumes go in, it's all HR that does it. Used to, you go through the physical therapy department, and you still can do that if you know someone. And what's gonna help y'all is most of you are gonna go to work where you do clinicals. Almost all my people last year went to work doing that. By the way, I have one girl that is does not have a job right now. And I think it's the only one who doesn't have a full-time job, and she's fixing to have a baby in a month. So, they're all working. The ones who are licensed are working. Kenneth went to work, Stein picked him up. He was doing an internship there at,
Is he gonna be at the other?
yeah, I don't know that he'll be at Fiena, but they did give him a full-time job with Stein.
Alright,
So,
good for him.
worked out.
So you shouldn't bring up salary?
I think that depends, why don't you ask Jay? I think that's one of the things that has changed.
My brother really negotiated this.
He's negotiated a lot of his stuff.
Like, he negotiated on his last job offer, like, he negotiated mileage and pay, and they keep coming back with offers, so.
Good. Now, where's he working?
He's working right now, he's working for a PRN company in Alma,
Okay.
but, he's applying to Texas for a traveling job, and they said he'd probably bring home like close to 70.
Well, they put you up in a hotel or
Mhm.
housing, and traveling is a neat thing to do. You'll learn a lot too. You're gonna feel very inept at times and not think I don't, so, but that's okay. You just gotta be able to get in there, get your books out, and learn everything you can, and be the very best PTA that you can be. Because traveling puts you into some positions that you gotta just perform. So, you can do it. Let's see.
Well, you get information from all different aspects,
Right.
all around the country, that would be awesome.
Yeah, you'd learn a lot. What salary ideas do you have? Do you like? I hope you like it. What have been your most enjoyable jobs, your previous jobs? Of course, these are just things, probably one of the ones that you get around here, what are your strongest abilities? How do they fit into with this company? How did you get them, and how can you prove that you have them? So, that would be some things. What are your weaknesses? What is a good weakness to have?
Too fine.
Being too often.
I get too involved with my patients. I have a hard time not being too involved, so I'm really working on that. I need to be able to leave my work at home. I leave work at work and separate my life into two different places. That's always a good weakness, and it is a weakness. You do have to be able, if you can't leave your work at work, it's gonna become a problem for you. You gotta be able to turn it off. And initially, you may not be able to do that. I don't know, did y'all feel that some on your clinical? It was really hard to leave some of those situations at work, but you get better at it. It was really hard for me. I'm such a
It's hard to leave it.
taken care of, and I'm a fixer. I'm not a fixer anymore. I've learned not to do that, by the way. I try not to fix y'all. I used to fix all of you, but I don't do it anymore. I just kind of try and stay away, let y'all fix yourself. But, and so I was a fixer for patients for years, so I really had to learn to do that, and I have. You can learn to do that, but you do need to learn to do that for your own personal, life, for your family's life and all of that. The other side of that is, you gotta be able to leave your family at home and go to work. You gotta be able to turn it off, and you need to learn to do that if you can't do it. Most men do that well, by the way. Men are much better at doing compartmentalization.
Couldn't wait to get to work.
And they can turn it off, they're better at that, but ladies, you gotta learn to do that, and you've got to be able to leave that at home, even if it's a horrible thing. Someone's fixing to divorce you. You got a really sick kid sick kids are usually let you kind of take care of them a little bit, but things happen in your life that you gotta be able to turn off. Especially something like that, your mother, you lost your mother last week. How long do they give you for that? About 2 days. You gotta be able to turn that stuff off when you go to work, right? So, just anything like that. Your house just burned down. Gotta get back to work next week, right? Gotta be able to turn it off. So, and that's why you want to keep your stress level as low as possible. And sometimes you make decisions to not do some things because you need to keep your stress level down, right? So,
Stress will kill you.
yeah, stress will kill you.
That seems like that would be one of my weaknesses for sure.
Is not being able to turn that off. And that's not a bad weakness. I'm just saying, come up with some weaknesses that aren't bad weaknesses.
Yeah.
You don't want to say, I can't get to work on time. You don't want to say, I have a hard time getting my notes done.
I have a drinking habit.
Yeah, I would, those addictions, that's not a good thing to share with them. I'm trying to think of some
I've
other good
almost
ones.
put my heroin ad, or my addiction, something like that.
Well, if you have, there are some things too in your background that if you need to share with that, make sure you do. Make sure you share those things beforehand. I don't think any of y'all do, but, let's see.
Are they allowed to bring up, religious, anything, like if we go to
They
church,
cannot
or if
ask
we-
you, and I would recommend probably, see, in the Poto area, and you're still in the Bible Belt, so I would recommend that you not, because it's better, it's just better for you not to talk about those areas.
You're at work or anywhere, you don't talk about politics or religion.
And actually, that's probably pretty wise.
You just
I for
don't.
sure wouldn't talk about politics around here.
Sound bad about that.
Democrat or Republican, I just would not. That's
Make a lot of
wise.
people mad.
Yep,
And probably.
I've learned that the hard way.
Yeah.
On both those
I support whatever that guy's in retirement support, that's all I do.
Well, see, you do have to kind of play the game, right?
I'll tell him anything he wants to hear.
Okay, as we get into let's go off the interview resume. Here are just a few personal quality verbs. You want some pretty strong verbs. And as he talks about about this, I'm just gonna read through this sheet, I just didn't have time to put it up for you, but,
From the
you don't
back
have this
of one of these.
resume on it?
It's on the back of the page we just looked at.
Okay, a resume needs to be 1 or 2 page summary of your skills. If you have not had a lot of jobs, you need to cut it down to 1 page, seriously.
Like, my last job, I was there 20 years, I wouldn't go past that, would I?
No, I wouldn't, no, and you're not gonna put, you probably aren't gonna put your high school down. You know, some of you who are 22, you put your high school down, but you know, there are things way back there. Like if you had a job in high school or college while you're going to school and you've worked 20 years since then, I wouldn't put any of that in there, unless it was relevant to physical therapy. It's your accomplishments, experiences, and education designed to capture prospective employer's interest. It says reflecting 5 years or less of experience should fit onto 1 page, so, you know, again, we'll look at that. If you think there's something that you should put down, then we can do that. The purpose of the resume is to get in there, to have an interview. Again, that's why you're already on top if you've done a clinical there, because they know you, they've already gotten comfortable with you in the clinic, they're gonna ask their PT people about you, and a lot of people go to work where they do clinical experiences. Suggestions in writing a resume. Sell yourself. You want to create a good impression by highlighting skills and abilities appropriate to the position. So there are some things that you don't have to put in there, but so we'll look at some of that if you have some questions. And if you will go ahead and put this resume together, Jay will be here next Monday, and he is a great HR person. I'm telling you, he loves it. It's like in his blood. He just loves it. So any questions that you have them ready. Go ahead and kind of put it together. What I want you to do is look up resume writing on the internet and just look at all the different forms that you can use. But these are some of the things that for sure you'll cover as we get on through here. You want to be consistent. You want to choose a pattern of spacing and information. Everything needs to look really good. Let me give you an example.
They have templates on Word.
Yes, they have templates, so you want everything to be, or does that look, is that pleasing to your eye? Everything's in line?
Looks good to me.
Yeah, this is a young man who was like 21 in my program. He had 1 job that he worked for UPS or something, and so that's his, it wasn't long. With references, you just put available upon request, but make sure that you have 3 references when they call you, that you can just give them over the phone or email to them. Please, if you use me as a reference, I want you to ask me. I don't mind, I'll probably reference you.
Can we use you as a
But
reference?
you need to, you don't want to put down references and not ask them if you can utilize them. It kind of makes people mad. And some people really don't have time to do it, and so they don't want you to do that, so it's easier. Some of the references that they're using now through the internet is a standardized reference. I get a lot of those, and it's emailed to me. I prefer not to do telephone ones because I open my mouth. You know, it's better for me to look at what I'm putting in and all that kind of stuff. But anyway, here's another one. Is that pleasing to the eye?
A little small there.
Well, she needed to get, it's okay because she got it all on 1 page. So see how everything is consistent on that?
Plus, you gotta understand that if somebody is looking for somebody to hire, 1 page. They get the one that's like 4 pages, they're gonna say, I'm not reading this, I got 50 more of these.
Right, and that's what Jay will tell you. Also, he will tell you that if there's a misspelled word on this, or a piece of grammar that's not correct, an HR person's gonna throw it away. They're English specialists, they know every piece of grammar. So how many times do you need to have this proofread? I'd say 3 times. It needs to be perfect. Trust me, if it's not consistent with what it needs to be, they're gonna throw it away. Unless maybe you have an in that you've already been a student there. But even then, I'm gonna tell you that if this thing doesn't look good, and you have some misspelled words in it, it's not good. So if you're not a good speller, you give it to someone who is. Take it to Chuck Cole if you had him. Take it to your English teacher. Take it to anybody to read it for you. I'm actually a pretty good proofreader, but not so much with grammar, but for misspelled words, I'm pretty good. But I would still want you to have someone else do it. So do it for each other, and then if you're good, you pick up misspelled words pretty easily, then probably you're a good proofreader. So just make sure that you can do that.
Well, my last job was hanging signs, working on a crane with that.
I would probably put that down for you to show, yeah, I mean, how long did you do that?
Well, I did it for like 10 years, but not at that company. I was only there like about a year.
Ask Jay that question, how you should do that, you know,
Write it down.
because of your age. You have to show that you have work, that you have good work experience,
Usually
I've
gaps in
been
employment
working forever.
yeah.
aren't gaps in employment usually kind of on?
Down every job in
I
your
hope
life.
not, 'cause I had some gaps.
No, I don't know, unless it,
It looks like they were 5 or 10 years.
yeah, go back 5 or 10 years, and then if they ask you, have it ready for them. And, but if you have something that, like, didn't you work for DHS? Health Department, I would definitely put that in there, you know, because that's a medical related type thing, so. The other thing, by the way, that's down here that Eric has is volunteer work. I don't know if you know, but that's getting to be kind of a big issue in,
I have some of that.
so you all can put down your hospice volunteer work, all that you did. So you can put, you can put down that you are, what he said was, we worked with Advantage Home Health at that time, Advantage Home Health and Hospice Poto, Oklahoma, certified hospice volunteer because you did your certification here. You guys did it with, not Advantage, but, Peachtree. And, certified hospice volunteer with experience. So they can ask you, 8 hours experience, quite, you know what, when I was doing my kids' junior league stuff, I mean, all that stuff in school, it was a shock that all they wanted was 8 hours of something. So put it down, put it down. I mean, they're impressed that you did 8 hours in your last 20 years, so, it's
Yeah.
always interesting.
What about, like, have you done the OK Mom? Have you heard of that?
The OK Mom?
Yeah.
I don't know what that one is.
No. Well, it's like, a bunch of it, it's got different stuff, but I went and did it for the dentistry.
Then yeah,
Yeah.
yeah. Oh, you mean like a,
Volunteer.
Oklahoma Mission of Mercy.
absolutely, yes. Yeah, I would put all that down. Present information in reverse chronological order, so you put the most recent at the top. Check for grammar, have a friend read it for you. Ensure that your resume is neat and visibly appealing. When you're actually handing out, usually you're, about 95% of the time now, you're gonna just email them your resume. Or put it into their website. Now, all your references are gonna be that way. But again, if you write in something, let's say they ask you some questions and it's on the computer, do not rely on spell check if you're not a good speller. I mean, THEIR and THERE is a big one that I see people misuse a lot. Make sure that you use I have seen and not I seen. That's another one I see a lot, because we say it around here and that's incorrect. So I have seen, you need to make sure you put that in there, or I saw.
And no you alls.
No, you all, yeah, don't do you all. Anyway,
Y'all need to hire me.
we'll kind of look at that, look at your wording, reread it to yourself. Your resume probably should not read like you talk, do you see what I'm saying? So, I mean, you want it to sound like you're a professional, right? It is, you need to have someone else do it, yeah, I would tell you to do that. Present yourself with the name you use in personal and business life, avoid nicknames. Do not use Bubba. None of y'all are Bubbas. Bubbas are not good.
Big Dog Daddy.
Bubbas are not good.
How about before you actually get your license, can you start sending out resumes?
Absolutely. I would take a resume with you to your clinical. Some of you are gonna wanna go ahead and if you're interested, I would do that. I'd start sending them out. They're not gonna look at them, you know, or ask them, when can I send you a resume? You know, what can I do here? And just start, you're gonna have to be proactive. Jobs are not like they were before. But like I said, except for Lance, obviously who's PRN, but, Lance is, I'm gonna just tell you about Lance and Blake's brother.
Very confident.
He just, life is easy for Lance and he just
Right.
kinda does whatever so as far as I'm concerned, he's making enough money and he's fine. So he'd go do something else, cause that's the way he is. So I consider him full-time, but I guess he's not. I thought he was.
He just kinda relies on whatever.
Yeah, he's just foolish and fancy
Moves
free,
every
so that's
3
why he's
months.
doing that.
Well, he
And a
PRN,
temporary position will be very good for Lance. I'm glad he's gonna do that.
he PRN, but he gets full-time hours.
Yeah, he really
Yeah.
does, doesn't he?
Yeah.
Yeah, I had heard look at is don't turn down a PRN position. What all these nursing homes are doing is they're hiring people PRN, and probably everyone working for a nursing home from last year, almost all of them are now full-time people. So, and that happened the year before too. They're not hiring, they're doing you PRN, and then they're looking at hiring you if you have a position open. So you may have to do that some. Health South the same way, Mercy Hospital, a lot of people are going in PRN and they'll hire them before they'll hire someone else. So if that's an option for you, then you need to look at that. Don't go, I would love for you to have benefits when you walk out the door, but they seem to be doing that a lot in hospital settings.
It's probably why to look at what kind of worker you are before putting
Yes.
it on.
Oh, yeah. So, and again, being in the clinical is part of that. They're seeing you, so that's gonna be good. Oh, good. I can't believe Bill's not in here. I don't know that they're using objectives anymore, so you can ask Jay about that and see on your form. Then education, just look at that. If you have a GPA higher than 3.0, note it. If not, don't note it on your education. This is just kind of a thing to get you started. Sometimes you might need two categories, relevant experience versus other experience, but again, I would probably at this point, since you need to limit it to a page. Now, it's good to go to 2 pages if it's something very relevant that you need to put in there. So just kind of keep that in mind.
That builds to this.
So that's, and then on this last page, that's probably an old, I would just put in resume, or resume templates or something like that. Omit needless items, leave all of these off, social security number, marital status, your health, for sure, citizenship. I don't know why, I don't think you have to put citizenship on there, but they can ask you that question. Age, they can also ask you if you can handle, let's say if you can handle lifting 50 pounds on the job. I mean, they can ask you questions that are required for the employment. I'm not expecting y'all to have any trouble. Irrelevant awards, you don't want to put down that you something that was in high school. None of y'all need to put down high school awards. Maybe some of you do. Jade might, like if she's valedictorian, because she don't have, how old are you, 21? Yeah, so 21-ish, 22-ish, you might put down some high school stuff if you don't have a lot of other stuff, because it is important. I mean, that's important, but if you've been out of school for 10 years, you don't want to put down high school stuff, okay?
So what about your GED, or as opposed to getting your diploma?
I would just put that, I don't know that I would put that down for you. I don't think that's an important issue. You've got a lot of college, and that's not a big deal.
So since I've been out for 10 years now, I don't have to put anything about high school?
I don't
Not
think-
even
no.
where I went to school?
No, you don't have to do that.
If you were sentenced to community service, would you put that on your, that you did community service?
Sentence to, well, you are gonna.
Maybe leave out the sentence part.
Right,
That you did community.
Have participated
Yeah.
in community
The problem is, they're gonna do a background check on you, so.
I was just
that-
asking for Paul.
Yeah. That's good. Yeah. So again, if you have anything on you might wanna get it,
Y'all can put your chip in
what's
there.
it called, off of there. So anything on there, you're gonna wanna get off.
It is expunged.
Expunged, because at this point, every medical, except for private practice, and I don't see them doing background checks, but y'all realize that even churches are doing background checks on their kid volunteers now, they're required to do that. So a lot of,
That's probably it.
oh, I'm thrilled, I'm not against it at all, but so background checks are very important. So, and I told y'all what came up on the this year's, I had a ticket that was 10 years old, but it was paid. I had a seatbelt ticket that came up. I had just crazy things. So we might actually want to pull y'all's off again because we're putting more on there than they ever have before.
I do have a question. On this objective, it says finance.
Let me read an objective to you that sounds like, kind of like